Hi, good afternoon. Welcome back to another Facebook Live that we're doing pretty consistently. This is Erin Gallardo. I'm talking to you today about a frequently asked question that we get from a lot of our clients with Parkinson's. And April is Parkinson's Awareness Month, so one of the things that the Parkinson Foundation was hoping people would embrace this month is just a way of bringing more awareness about Parkinson's, about some frequently asked questions of Parkinson's, of things that people need to know about it, spreading knowledge. So we wanted to use this time to spread some knowledge that we have, because we work with a lot of people with Parkinson's, and so we do get a number of frequently asked questions about it. So this is one that is pretty typical for people that we work with, about blood pressure. So that's what I wanted to talk about today. So thanks for joining in. So Parkinson's, a lot of people know, has a number of different symptoms, and the ones that are pretty common that people think about are the motor symptoms, like posture problems, difficulty walking, and moving really slow. But there's also a number of non-motor problems that can affect people pretty significantly, and blood pressure is one of those non-motor symptoms. And the Parkinson Foundation says that about 1 in 5 people are affected by this lowered blood pressure, and what it's really called is orthostatic hypotension. And what that means is your blood pressure lowers when you change positions, like going from sitting to standing. So a person might go from sitting to standing and feel really lightheaded or dizzy, and that could be explained by potentially them having orthostatic hypotension. So I'm going to talk about that a little bit today, and it's not medical advice. This is just a little education, some things that I've learned from courses and from research, but definitely check with your medical physician before implementing any new strategies if you feel like this is happening to you, or just discussing if you're getting some of these symptoms with your physician as well, just to throw that out there. So the Parkinson Foundation estimates that about 1 in 5 people with Parkinson's have this orthostatic hypotension, but it actually might be closer to 50% of people with Parkinson's disease. However, maybe only about 20% of those people are actually symptomatic. So it might be happening in a number of people. You may just not experience symptoms from it if it's happening to you or a loved one. So the reason it's really important and we wanted to talk about this and address it is that if the blood pressure becomes really low when a person gets up, it can make them feel lightheaded to the point where they could actually pass out and fall. So that's pretty concerning. And having that lowered blood pressure when you get up and move can make it really hard to do your day-to-day activities, and it makes you feel like you have pretty low energy, and you just feel really off. So it can make your balance off. We definitely don't want someone to be falling. Maybe it makes it harder for them to go into social activities or out of the house, going places, because people are concerned about balance or having falls out and about. And it can also make it hard to exercise, and exercise is so important with Parkinson's disease and as well as with blood pressure, because exercise pretty much helps everything. So hi, Aunt Jane. Oh, so good to see you on here. So exercise is really important. So we want to make sure people are able to exercise and do the things that they want in their daily life and not have any limits. So the definition of orthostatic hypotension is when someone would go from sitting to standing and they would have a drop in their blood pressure of more than 20 millimeters of mercury for that top number, the systolic blood pressure. So, and this could happen within 3 minutes. And then a person may or may not have symptoms from experiencing that. So what we would do is check blood pressure in sitting and then have the person stand and check it again and see if there's a really big drop, like 20 millimeters of mercury drop in the difference, and then that's how we would know if that's happening. And then also asking for symptoms, if a person feels lightheaded or lethargic or a little fuzzy or something like that. So Some of the ways that you would want to address and treat this issue would be to really first try to evaluate if there's anything contributing to that blood pressure change that we can just get rid of. So we want to knock out any aggravating factors first. So some of the things that might be contributing to it would be like blood pressure medication. So some people are on medication to help control and lower their blood pressure, and maybe they were on this medication from before they realized their blood pressure started dropping or something like that. So an alpha blocker or another antihypertensive could be something to look at with your medical physician to see if that's contributing or needs to be adjusted so that your blood pressure isn't dropping so much. Another factor could be if someone is on a low salt diet. Not having enough salt and retaining enough water can make the whole blood volume lower. So that would be something to look at. And not drinking enough water, like dehydration, would be really, really important to address. So if any of those can be addressed first, like that's really a first important step. So make sure you're drinking enough water. If you're allowed to have more sodium in your diet, making sure you do get enough of that definitely check with a physician about before knowing if you're supposed to have more salt in your diet. And then addressing blood pressure medications with your physician, seeing if there's anything that can be adjusted with that. Okay, so once you address all of those things and if the blood pressure is still an issue, next, you do want to still look at what are other non-pharmacological measures that you can take. It's going to be a lot easier, better, just easier on your body to try to do this with something non-pharmacological. Blood pressure is like a moving target, so it can be really hard even to dial in the medications just right. So if there are ways outside of adding more medications, that really is an optimal next step to do. So one thing that a person could do to help expand that intravascular volume is like sleeping with your head elevated 30 to 40 degrees. So at night, staying with a little bit of an incline when you sleep can actually help you to not have such a dramatic drop in your blood pressure through the night and into the morning. So trying that. If your physician or cardiologist or whoever is monitoring you says it's okay for you to have more sodium in your diet, that may be something to help increase blood volume so that you don't have such drops in blood pressure as well. Other physical maneuvers actually can help increase blood pressure and prevent it from dropping. One of the things that really happens that makes you feel lightheaded as your blood drops is that it just starts to flow down and pool into your low belly, into your legs, and it makes your head feel really light. So you can do some physical maneuvers to help prevent from that blood just dropping and pooling down there. And one of the things you can do is cross your legs. That'll help kind of keep the blood volume up. When you're standing, putting one leg up on a stool so that it doesn't just fall and pool down as much. And then compression garments. We use these a lot in our clinic, but it's not enough to use the stockings that sometimes you might see at compression stockings that just go up to the knee or even to the thigh. Those aren't enough. You actually need a compression garment that's going to go up to the mid-belly. This is where the majority of our blood volume lives, is in our sort of belly area. So that's the blood area that you need to compress in order to keep enough blood volume up where you want it by your heart, head, brain, all of that stuff. So using an abdominal binder is much, much more effective than any kind of leg compression. And I know people tend to want to just start with the legs and do that first. Maybe it seems a little bit easier or just less invasive or something, but it's really not effective. So you do need to go with an abdominal binder to kind of keep that blood volume up where it's supposed to be. So then the other thing that you should actually consider is that our blood pressure drops quite a bit after meals. So just being aware of that and noticing if that's when a person might feel some of their more common symptoms It's really actually very correlated with our insulin release. So if you're eating something that's really processed and sugary, you might have a bigger change in your blood pressure than if you were to eat something like more vegetables and whole foods and plants and beans and fiber, that kind of, those really good foods for us. So really try to avoid eating things that are too sugary and processed to help keep your blood pressure as well as your blood sugar a lot more regulated. So that's definitely something that probably a lot of us could really work on to help keep blood pressure where it needs to be. And of course, drinking water. Don't restrict how much water you're drinking. Really, really important. Your blood volume is made up of water, so you have to drink enough water in order to keep your blood pressure at a good level. And there have been some studies on like, well, how much water is enough water? I know here we give people water all the time if they seem dizzy and their blood pressure is low. And so what the studies have shown is that 500 milliliters is the amount of water a person needs to drink in order to bring their blood pressure up to where it needs to be. So we're trying to have some water causing a little bit of vasoconstriction so that the blood pressure can come up, and that's how much you need, 500 milliliters. So that may seem like kind of a lot. It's more than a cup of water. So it's more than you might think you need to drink, but that's what the research has shown in order to improve blood pressure. So really only after you try to address any of the aggravating factors that we talked about, like if you're on a medication that lowers blood pressure, if you're not getting enough salt in your diet, and if you're not drinking enough water, and then you try using an abdominal binder, drinking more water, potentially altering your diet, less sugary, definitely altering your diet, less sugar, less processed foods, potentially adjusting how much salt intake you have, whether if your physician is okay with that. Trying some maneuvers like crossing your legs more, or when you stand, having your foot on something may or may not be actually a practical maneuver for you, but just a little tip. Once you exhaust some of those resources and issues, then you may try looking at some pharmacological means of intervening. Oh, sorry about the phone call. So there are a couple medications that do help, because this is considered neurogenic orthostatic hypotension. It's from the nervous system. It's not responding as well as it's supposed to constrict your blood vessels when you change positions because of the Parkinson's disease. So there are medications that may help with that kind of root factor. But like I said, it can be tricky. Blood pressure is such a moving target that if possible, really try to adjust some of these other behavioral things, diet and water drinking things. And exercise can help with this over time as well, like making sure you're getting your cardiovascular system stronger is really, really important. So getting your daily dose of exercise, we always have to throw that in there. The other thing you may consider is just, if you're able to, talking to your doctor about this, avoiding taking your Parkinson's medications before bed so that you don't wake up with a really, really low blood pressure. So those are my tips from today. Definitely check with a physician if you feel like you're having some low blood pressure issues, the orthostatic hypotension, like when you get up, your blood pressure is dropping and you're dizzy. There are some ways that you can address it by changing some behaviors, medications, and lifestyle things before maybe trying to go into a new medication. But I think there's some simple things to try, and I hope you guys got something out of that and learned something new. And really look forward to chatting with you all again about frequently asked questions in the future. So if you have any questions you'd love for us to address, please leave them in the comments so that we can talk about them at some point in the future and really help you on your journey. It's been fun chatting about this during Parkinson's Awareness Month, and we're really happy. We love all of our clients with Parkinson's, and we just really want to spread knowledge and awareness and love to all of you out there. So thanks so much for tuning in, and please visit us on our Facebook page and leave any comments, and like and follow us, and let us know if there's anything else you want us to talk about. Have a great afternoon.